Hi, I'm Dee, and medical assistants are at the heart of healthcare. It is a 12-month program. We start in August and we go through an externship from May, June, and July, and then you're ready for employment. We work in 3 different areas: administrative, clinical, and lab. So we're used primarily in the emergency rooms as emergency technicians. We're used in the labs. We're used in dialysis clinics, specialty clinics, urgent care, and most of all, our doctor's offices.
Well, first I chose Ellsworth because it's close to my family and I like the small community, because I feel like in a smaller college you have more one-on-one time with your faculty and the students, so it's easier to, if you have questions about the class or questions about notes or testing, it's a lot easier to get a hold of them and actually get that one-on-one connection. I chose medical assisting because in the future I want to go into nursing, and I figured medical assisting is one step closer to that, and it will get me in the field and get to test out the waters to make sure I actually want to go farther into it.
Well, I actually chose medical assisting because I'm interested in acute care with patients. I don't want to do the long-term care, and I thought it would be something that I could see myself doing for the rest of my life and being happy doing. And I chose Ellsworth because it's in my hometown, and I've come here before and had really good previous experience with it.
I chose Ellsworth because it's in my hometown and it was a lot easier for me to live at home and I get to save money. And then for the medical assistant program, I chose that because I wasn't quite ready for the nursing program, because that was kind of a hard step and I don't think I'm quite mature enough and ready for it. So or the medical assisting program was a great first step, and it definitely is preparing me for the nursing program.
I kind of got directed towards Ellsworth because in high school I took some classes as a senior and then went to a university, and then I decided I didn't really know what I wanted to do, so came back to Ellsworth and started their medical assisting program just because it was only a year, and figured if I like it I'll have my degree in a year and then can go out in the workforce.
And what makes our program unique at Ellsworth is that we have 2 classes that are distance education, where you can go online, take the class, and come in once a week to meet with the instructor and do testing. The clinical, however, is all on campus, and the lab is all on campus, and that is 2 days a week. Fridays, there are no MAP classes or medical assisting classes. You have that day off on Friday.
Oh, the faculty here is great. I've never had any issues with any of them in any classes. I especially love Dee, who's the medical assistant director, because she's just so fun and spunky, and it's so fun, but yet we know when it's business time, and she makes class really fun.
Faculty is amazing for the medical assisting program. Dee is a great instructor. She is not only like your instructor, but she can be your friend at times where you need her to be, and she will help you out. If you have any questions, anytime you need help, you just give her a call, give her a text, and she'll be like, oh, you can come to my office, or she will sit there and she will talk you through it. And if she can tell that you're struggling, she'll ask you questions and she'll test you.
Your externships will be May, June, and July, Monday through Thursday. I place you in an externship site that I feel that A, you will either be employed, or B, that you will get your most experience. You will be doing that in administrative, clinical, and lab. So you will rotate in all 3 areas so that you get your experience in all 3 areas.
I'm actually really excited for my externship. I'm going to do it at the Hanson Family Hospital where I work now, so work with my same coworkers, and it's nice that you can get some job experience before you actually get a job.
It's really given me some initiative to see where I want to go with my future, and I like the fact that in this program it's hands-on, so you're not going to go out into the field with no hands-on experience clueless. You'll have the familiarity to it, so I really enjoyed that part of it.
The externships that are coming up, I'm really looking forward to. We get to go to an actual clinic or hospital for, I think, 2 months and work in the fields and do hands-on stuff, and we'll be working full-time Monday through Friday, and it's just getting us prepared for what the real life's going to be, but yet we're still training in class. So I'm really looking forward to it. My classmates and I really have bonded. We have a smaller group. I think there's 9 of us, and we all just kind of bond as a family. When one of us is struggling, we all help out. When we have questions, we text each other or we email each other, or just talk, and we all help each other out to make sure that we get through it all together.
The scholarship opportunities for the medical assistants, we have the KIBBE grant for first-time medical assistants that come into the program, but they have to meet the Iowa requirements. We also have the Maxine Williams Scholarship that is given through the AAMA, where you have to meet certain requirements as well. International students, however, are eligible for the Maxine Williams Scholarship. And those applications come directly from me, which I give the students, and they're usually due in February.
There is a lot of scholarships available, especially through the medical assistant program, and we're still finding new scholarships available. Like, I'm turning one in here in a couple months. But the scholarships I got through the medical assistant program definitely helped me with like my book charges and all the medical equipment, because we need a bunch of certain medical equipment for the class. So getting those scholarships really helped be able to afford all that stuff.
The students, the graduates, I am pleased to announce that we have a 94% passage rate in the national certification. Some students choose to go on into their field in another health professional area. Some students will be employed in insurance companies where they go out to the homes and will collect the urine and the blood and do a physical assessment. They also will be employed by drug companies for their research data, which they will do blood and urine as well. We are an accredited program with CAHEP, C-A-A-H-E-P. It's a very prestigious part of accreditation. We also are, once you get certified in the national certification, you are considered a CMA. Every 5 years, you have to receive 60 CEUs in order to keep that up. That's a privilege to have the C in front of the MA. It also will give you approximately $2 to $4 more an hour if you are certified.
A year from now, I'll be working as a medical assistant. In 5 years, I hope to be studying pre-med to be a physician.
I like the medical assistant program because it's not strictly nursing, it's also business and laboratory. So if you didn't know what you wanted to do, or if you were just going to try the nursing program, it's a good start to realize maybe you don't like the nursing, maybe you want to go lab, or maybe you want to go into the business side of it. So it's not just nursing, there's a wide variety of things that we can do.
I would like to tell you a little bit about the wages that the medical assistants are getting these days. If you are a certified medical assistant, like I said earlier, it's $2 to $4 more an hour. Last year's grads started at $15.60, and some of them are making $20 an hour. So come on, consider it. You're a multi-skilled professional that can work in administrative, clinical, or lab. Come on, give us a try.